Urinary lithiasis is a condition characterized by the formation of stones in the kidneys or urinary tract. It most often affects the upper urinary tract but can also develop in the bladder. The most common presenting symptom of urinary lithiasis is renal colic, which occurs when a stone obstructs an excretory pathway, causing sudden and intense pain, often localized in the flank or lumbar region, and may radiate to the groin, thigh, or external genital organs, depending on the stone's location. The reference examination for diagnosing kidney stones is non-contrast abdominopelvic computed tomography (CT scan). There are several types of urinary stones, each with a different composition. Knowing the stone's compositions influence the choice of treatment and long-term management of lithiasis. A major concern in managing urinary lithiasis is the impact of stones on the excretory tract and renal parenchyma. In severe cases, lithiasis can be life-threatening, particularly if complications such as obstructive pyelonephritis occur. There are some lithogenic factors that can increase the risk of developing these stones. First, general lithogenic risk factors. These elements predispose a person to develop kidney stones. Age and sex. Urinary lithiasis frequently occurs between 30 and 50 years of age, with a male predominance. Men are more often affected by kidney stones than women. Some populations are less susceptible to lithiasis. For example, Black African and Asian populations are less affected. Seasonal factors. There is a summer predominance of kidney stones, particularly during hot periods or Ramadan. This is due to dehydration, which is more frequent in summer and during long fasting hours. Certain professions carry a higher risk, especially those exposed to dehydration, such as outdoor workers or people working in hot environments. Frequent dehydration is a significant factor in kidney stone formation. A Western-type diet, rich in proteins, salts, and sugars, is also a risk factor. An unbalanced diet, particularly excessive consumption of animal products, can promote stone formation. Secondly, lithogenic risk factors related to stone chemical nature. There are two main types of stones, mineral stones and organic stones, which form depending on urinary pH. Calcium oxalate is the most common type of stone, representing approximately 80% of kidney stones. It can form at variable urinary pH levels. Calcium phosphates. These stones form in an alkaline environment when urinary pH is above 7. They are often associated with urinary tract infections or specific metabolic disorders. Ammonium magnesium phosphates or struvite stones. These stones are often linked to urinary tract infections caused by urease-producing bacteria such as Proteus, Pseudomonas, Klebsiella, and Staphylococcus. Organic stones like uric acid stones. This type of stone is related to hyperuricemia, which may result from disorders of uric acid metabolism or diets high in purines. Uric acid stones generally form in acidic urine, pH less than 5. Cystine stones are rare and usually caused by a genetic disorder. Finally, a drug-induced lithiasis. Keep in mind that almost all medications have the potential to induce stone formation. Certain drug classes, such as diuretics, uric acid inhibitors, and calcium-containing medications, can increase the risk of kidney stones. Medications can alter the chemical composition of urine and promote crystal formation, creating conditions favorable to lithogenesis.